Okay, so I'd like to welcome Leon Hirvelä from the University of Helsinki, and he's going to talk to us about some work that he and his colleagues have been doing about the incidence of eating disorders among people with type 1 diabetes and the treatment of eating disorders. So, Leon, could you provide us a little bit of background on eating disorders in people with type 1 diabetes and what interested you in studying this further, please?
Yes, thank you. Well, previous studies have shown over twofold higher incidence and prevalence rates for eating disorders among people with type 1 diabetes. And insulin restriction is a hallmark and as a compensatory behavior for eating disorders for eating disorder patients with type 1 diabetes. And it is well documented that eating disorders among those with type 1 diabetes are accompanied with major increases in diabetes-related complications, and also mortality rate is increased. So we know also that eating disorders among those with type 1 diabetes are quite hard to treat. But evidence on how these patients are actually in real life settings treated is quite scarce. So we aim to assess the incidence of hospital-treated eating disorders in Finland among people with type 1 diabetes compared to that among diabetes-free control individuals. And further, among these detected eating disorder cases, we aim to assess their treatment as in newly prescribed psychotropic medications and hospital treatment as inpatient and outpatient treatment for eating disorders.
Oh, great. And so in Finland, you have access to quite a large cohort, don't you, in various databases that can be used to try to gather data. Could you explain a little bit about how those databases work and interact, please?
Yes, thank you. Well, our study was based on a caring project, which comes from cancer risk and insulin analogs. So it was primarily gathered for a very different kind of project. So the cohort consists of people with diabetes and diabetes-free control individuals. So data on prescription medication purchases and reimbursements were provided by the Social Insurance Institution of Finland. And patients with diabetes were defined as insulin users or other blood glucose lowering drugs, or users of other blood glucose lowering drugs who had made at least one purchase between the 1st of January 1997 and the 31st of December 2010. And all identified insulin users, as well as a 50% random sample of users of these blood glucose lowering drugs, excluding insulin during this period in Finland, were included in this whole original cohort. And we wanted to guarantee, or in the preliminary collection of this cohort, the researchers wanted to guarantee only new diagnosis of diabetes. So that is why 1996 was the first wash-in year, so that no one in the cohort had a insulin or other diabetes drug prescriptions before that year, or during the 12 months.
Yeah, that makes sense.
Right. Yeah. So the diabetes-free control individuals were individually matched to the diabetes group by age, sex, place of residence, and start of the follow-up date. And for the current study of eating disorders and type 1 diabetes, we selected from this caring project participants with type 1 diabetes and their diabetes-free control participants. And we defined patients with type 1 diabetes as individuals with only insulin as glucose-lowering medication in the start of the follow-up and who were aged less than 30 years.
So is that on the assumption, is it that those people that were using other glucose or lowering medications were more likely to have type 2 than type 1? Was that the
Yes.
reason for that exclusion?
Yeah, because virtually all type 1 diabetes patients use only insulin as their anti-diabetic medication, and respectively, those with type 2 diabetes usually begin their medication with other kinds of medications than insulin.
Mm.
Of course, if you're severely ill patient with type 2 diabetes, you might use only insulin, but you are not usually aged less than 30 then,
Yes. Yep.
fortunately.
Yes.
After excluding all individuals with an eating disorder prior to this follow-up, our analysis comprised 11,055 individuals with type 1 diabetes and 11,055 diabetes-free control individuals. And also, as you mentioned, other nationwide registers were also linked to this cohort. We had access to all hospital-treated ICD-10 defined diagnoses in Finland through the Care Register for Healthcare, which comprises virtually all inpatient and outpatient hospital care in Finland. And from there, we had data on this new eating disorder diagnosis. And we obtained information on psychotropic medication use after an eating disorder diagnosis using reimbursement data from the Social Insurance Institution of Finland, which I mentioned earlier. It was the same institution or register where we got our diabetes definition.
Oh, yeah. So you could look at the insulin prescriptions as well as the psychotropic medication from the same database.
Yes, that is right. So, and data on socioeconomic status and place of residence were obtained from Statistics Finland. So that's another nationwide
Yes. Yeah.
register in Finland. And yes, so we followed the 11,055 individuals with type 1 diabetes and the same amount of diabetes-free control individuals for incident eating disorders until the date of first eating disorder diagnosis, death, or the 31st of December 2017, whichever occurred first.
Mm.
And among these detected eating disorder cases, we were interested in the new prescriptions of psychotropic medications and in and outpatient hospital care for eating disorders.
Mm. And so what kind of analyses did you do once you'd gathered the data? What kind of analyses did you do, say, for confounding factors and other variables in order to answer your question?
Yes, we used Poisson regression to model incidence and incidence rate ratios with 95% confidence intervals. And first, we assessed incidence and incidence rate ratios of eating disorders among individuals with type 1 diabetes versus these control participants. And we adjusted the multiple adjusted models for age, sex, date of the start of follow-up, and socioeconomic status and place of residence. So we had, fortunately, quite a lot of social demographic data to adjust with.
So that's to rule out that there aren't, for example, socio-demographic factors that might influence eating disorders. Yep.
That's right, yes. Then among all eating disorder cases that were detected, we assessed also with Poisson regression the incidence and incidence rate ratios of psychotropic medication use for individuals with type 1 diabetes versus individuals who did not have diabetes.
Yes.
And yes, and then finally, and about these psychotropic medications, to assess only eating disorder associated medication use, we excluded from these analysis those who had used these drugs before their eating disorder diagnosis.
Okay. Yeah.
And
Well,
finally, yes.
no, carry on.
Yeah. And finally, we assessed associations of diabetes status, sex, and place of residence with means and 95% confidence intervals of outpatient care visits and inpatient care days per year using linear regression.
And that's looking at outpatient or inpatient care specifically for eating disorders rather than for other comorbidities, or?
Yes, or the eating disorder diagnosis was
Mm,
always linked with the treatment,
yeah.
outpatient care day,
Mm, mm,
outpatient care visit, and inpatient
yes.
care day.
Mm.
So the doctor who had treated the patient had always put that eating disorder diagnosis to that appointment.
Okay, great. Well, that sounds really like a really robust set of data. What were your main findings?
Yes, so during a mean follow-up of 13.1 years, there were 175 incidence cases of eating disorders among those with type 1 diabetes and 75 among those control participants, which yielded an adjusted incidence rate ratio of 2.35, and the 95% confidence intervals ranged between 1.80 to 3.09.
So that's in line with the indication that you said that there was from previous studies that there were higher incidents of eating disorders among people with type 1 diabetes.
That's right.
Yeah.
So we have similar incidence rates in Finland than
Mm,
in other countries as well. But what was something new findings, over 60% of the patients with eating disorders had used some kind of psychotropic medications, and we define these as antidepressants, antipsychotics, and anxiolytics
mm,
after their eating disorder diagnosis.
hmm.
However, we did not find any differences in the use of these medications between those with type 1 diabetes and those without diabetes. Yes, and finally, probably the most dramatic finding was that eating disorder patients with type 1 diabetes received less outpatient hospital treatment for their eating disorder than those without diabetes. So the mean outpatient hospital care visits per year was 3.32 for those with type 1 diabetes and 5.33 for those without diabetes. And the adjusted difference for this was 1.24 visits per year. And the 95% confidence intervals ranged between 0.39 to 2.08.
So that's really quite a surprising difference, isn't it?
Yes, it's really something. However, we did not find a statistically significant difference in the inpatient care for eating disorders.
Hmm.
So probably the most severe cases are treated quite similarly.
But it looks like then the perhaps slightly less severe cases of eating disorders, there's a disparity between how people with type 1 diabetes might be treated and as compared with those without.
Hmm.
Yes. So do you have any idea what might be behind those findings?
Well, of course, from this register-based data, we cannot draw any firm conclusions of these possible reasons, but based on previous literature, we can speculate something. Uh, um, the reasons are probably quite diverse, including psychological aspects to specific to type 1 diabetes, such as illness perceptions, coping strategies, the complex needs of type 1 diabetes patients in regard of their treatment.
Mm,
Also other kind of psychiatric morbidity, which comes with often with type 1 diabetes, such as anxiety and depression. So this
yeah.
is probably something that might contribute. Uh, so uh, we couldn't, yeah, there's always, of course, at least when we are thinking about the higher incidence of eating disorders among among those with type 1 diabetes. So one could think that there might be some ascertainment bias. That is, when type 1 diabetes patient is usually under a medical doctor's examination regularly. So the doctor might recognize some kind of eating disorders better than from a random individual from the population. But a large interview-based study from Canada was done on the prevalence of eating disorders among type 1 diabetes versus diabetes-free controls, and they got similar results than other studies based on registers.
Yeah.
So it's not likely that only those it's that the higher incidence would be only due to ascertainment bias.
So the ascertainment biases might then be an indication that more less, but a higher number of less serious cases of eating disorders would be picked up because the people with type 1 diabetes are regularly seeing their doctors, whereas those same less severe cases might be going unnoticed within the general population.
Yes.
But the findings from Canada indicate that that's probably not the case.
Yes, that's right. So reasons for this undertreatment might also be previous studies have shown some adherence issues among patients with eating disorders and type 1 diabetes, and dropout rates from eating disorder treatments are also quite high. And these dropout rates are correlated with the patient's lower motivation and lower perceived intensity of the eating disorder. So these things can also contribute. Also, it is from our data we couldn't assess how severe these eating disorder cases were, but earlier evidence indicates that the medical and psychiatric characteristics are not that different from between those with type 1 diabetes and those without diabetes, like the eating disorders.
So you'd expect the treatments in theory ought to be similar, because if that you would perhaps expect that the optimal treatment for those patients would be similar if the form of the eating disorder is similar between people with and without diabetes.
Yes,
but in fact that's not the case.
Yes, that's right. uh, Yes, other possible reasons for undertreatment of eating disorders among type 1 diabetes patients include the lack of evidence-based treatments available for this group, the complexity of training, of treating co-occurring eating disorders and type 1 diabetes, and lack of healthcare personnel with adequate knowledge about both eating disorders and type 1 diabetes.
That makes sense.
And qualitative research, which has been based on interviews of patients with type 1 diabetes and eating disorders, have shed some light to this issue. And these patients often they feel that they are in need of multidisciplinary collaboration between the professionals, and they need professionals who understand both disorders.
So is that if you were to give some advice to patients and their doctors and public health authorities, is that what you would mainly suggest, that some kind of interdisciplinary collaboration is needed in order to address this problem?
Yes, for doctors and healthcare professionals who treat these patients, I would say that it's really important to recognize that people with type 1 diabetes are at risk of developing an eating disorder. So you have to keep that in mind, actually, every time you meet these patients, and especially when you are seeing that their diabetes treatment isn't going that well. So it's often really important to keep in mind that there might be an eating disorder which is going on. And it's also important, as you said, that these professionals are are making collaboration with each other, the eating disorder professionals and both the type 1 diabetes treating professionals. And of course, they need to recognize the needs, the specific needs for these patients. And for patients, I would say that it's important that you discuss with your healthcare professionals about your needs and about your eating disorder or possible eating disorder, and bring it up.
Yeah.
And ask for help. And you deserve the help and you need the help. And for public health authorities, I would say that the discrepancy in this treatment intensity needs to be reduced in order to alleviate the burden of this severe dual condition. And also targeted treatments are needed for this group.
So is this something that you're planning to carry on doing some more further research in this area yourself?
Yeah, well, probably yes. We have preliminary plans to do further research on mental health issues and type 1 diabetes from this caring cohort, possibly also about eating disorders, some more. Yeah.
And are there other groups that you're aware of in other countries or elsewhere in Finland that are studying the issue in a similar way or from a different aspect, psychological aspects or other aspects of eating disorders and type 1 diabetes?
Yeah, well, type 1 diabetes and eating disorder research is studied. Actually, we are not familiar with groups who had done like the exact similar kind of studies that we did about the eating disorder treatment. Like,
yeah, so it's one of the first of its kind.
yes, at least in like this population level, which we did, or the nationwide level. However, since healthcare registers are of high quality in the Nordic countries, at least, so I would encourage all researchers in the Nordic countries and in other countries as well to do research about register-based research about eating disorders and type 1 diabetes. So possibly in the future we could do some kind of meta-analysis or systematic reviews to address some other kinds of questions. For example, how the use of psychotropic medications are linked to the poor outcomes of eating disorders and type 1 diabetes.
Because I suppose the treatments that are used may differ a little bit from one country to another as well. So it'd be interesting if other groups in other countries start to look at this issue and possibly being able to compare notes to see what are more successful strategies than others.
Yes, yes. I would say that would be really interesting.
Great. Well, I wish you the very best of luck with your future research and looking forward to seeing your paper published with us. And yeah, very nice to speak to you.